Hi students, hope you are all doing good. In this video, I want to discuss about minor ailments in pregnancy. What are these minor ailments in pregnancy? See, basically during the course of pregnancy, there are various changes that occur in the woman's body due to say hormonal changes or the pressure of the gravid uterus. Okay, so many changes will happen in the woman's body and so many physiological changes are also seen. And some of the physiological changes that are going to cause some minor discomfort in the women. Okay, so these are known as minor elements. Okay, these are mostly not due to any pathology or something, but these are some of the common ailments that can arise in pregnancy, right? Okay. Now, first one, I want to start with vomiting and nausea. Now we know this is one of the most common complaints we can hear from women, and it mostly happens due to human chorionic gonadotrophin, okay, but it can also occur due to the hormones estrogen and progesterone, okay. And we all know that this nausea vomiting starts around 5 to 6 weeks of gestational age, peaks around 10 weeks of gestational age, and it will be reducing after or We all know that vomiting in pregnancy starts around 6 weeks and this peaks around 10 weeks and it is going to reduce by or after 16 weeks, okay. So, generally the curve is going to be like this, okay. So, most of the times after this we do not have any nausea or vomiting, but if you see even in some 15 to 20% of the cases, okay, 15 to 20% of the cases, after this also the nausea and vomiting can continue into third trimester, okay. And among these 15 to 20% cases, again, okay, if you see again some 5% of the cases can develop nausea and vomiting till delivery. Understood? Okay. Now, most of the times up to 16 weeks it is happening means it will be mostly physiological, okay, it's mostly physiological. But if it is proceeding after 16 weeks means you have to keep some pathological causes also in mind and have to try to rule out that. Understood? Yes. Now, we have a common term that is morning sickness that was used to describe nausea and vomiting in pregnancy. But remember, this nausea and vomiting can happen any time during pregnancy, okay. It can happen any time during pregnancy, not necessarily during the morning, okay. So, this name is again a misnomer. Understood? So, how we will be treating nausea and vomiting? Okay. So, treatment, we have to ask them to avoid spicy, acidic or high fat food, okay. And if you see the medications, you can give pyridoxine, okay, 10 milligram, okay, that can be substituted with doxylamine, okay. If not subsiding with pyridoxine alone, you can add doxylamine. Then after this, suppose if it is not controlled with the doxylamine and pyridoxine, you can even give metoclopramide or promethazine, okay. And the next drug you can try was ondansetron, and finally you can even give them corticosteroids, okay. So, this is how we will manage nausea and vomiting, okay. And now I want to discuss about heartburn in pregnancy, okay. So, this is another common complaint you will hear, okay. So, if you ask me heartburn, mainly we know the progesterone hormone is high in pregnancy, okay. Progesterone is going to cause relaxation in the esophageal sphincter, Okay. So, relaxation in the esophageal sphincter. Okay. See, for example, this is the esophagus and this is the stomach. Okay. So, what is going to happen is this esophageal, that is a sphincter here, right? So, that is a sphincter here. Okay. So, this esophageal sphincter is now relaxed by progesterone. Okay. So, progesterone is acting on this and it is being relaxed. Okay. We already know there are gastric acids that is present in the stomach. So, when this relaxation is happening, okay, what is going to happen is these acids are going to enter into the esophagus from the stomach and this will generally produce a sensation of heartburn or acidity. Understood? Okay. Now, so this is mainly aggravated in late pregnancy, and if you see, this is mainly aggravated in late pregnancy. Why? What is going to happen in late pregnancy? Your fundus is going to enlarge, right? Your uterine fundus is going to push the stomach further up, right? And there is a compression from downwards. So, there is a more chance that more acid reflux happens. Yes, can you understand? Yes. And increases the reflux. Can you understand? Yes. Now, how you can manage this? Basically, this can be managed by avoiding heavy meals. Okay, and asking them to take in 2 to 3 portions. Okay, say some small portions. So, basically we have 3 main meals, right? A breakfast, a lunch and a dinner. So, in these patients whom there is a nausea and vomiting or heartburn complaints, what you can ask them is, you can ask them to split up the meals into 2. Okay, for example, it can be split up from 3 main meals to 6 small meals. Can you understand? So, that will help. And the next one is, even you can add liquid antacids or calcium containing antacids, or you can even add H2 receptor blockers. Yes? Okay. Now, we will see the next common complaint you may have. In the GIT itself, it is constipation. Again, it is due to progesterone. Okay. So, it will be causing diminished bowel movements. Okay. And some other causes which may cause progesterone include if there is a emotional stress or sometimes as a side effect of iron tablets also, because we will be supplementing iron from 3rd trimester, right. Now, how will you manage this constipation? Management we can do by increasing fluid intake, increasing dietary fibers and encouraging physical activity. Then you can even prescribe stool softeners. Okay. So, stool softeners can be prescribed. Okay. Next thing we can see about leg cramps. Okay. So, leg cramps, there are many causes. Okay. Causes may include, number 1, there is a deficiency, okay, of diffusible calcium and magnesium ions. Okay. And there is an increased level of lactic acid accumulation, or there can be fatigue, okay, from carrying the pregnancy itself. Okay, carrying the pregnancy. Okay, now you can do manage leg cramps by giving a massage. Okay, so you can ask them to extend the leg and dorsiflex the toes. Okay, because there is a deficiency of calcium and magnesium ions, you can ask them to take calcium and magnesium supplements. Okay, you can ask them to stay hydrated. Okay, and you can even ask them to take a warm bath before bed. Okay, and next common ailment you can see is carpal tunnel syndrome. Okay, so what's happening in carpal tunnel syndrome means there is pressure of the fluid, okay, on the median nerve. Okay, now what is going to cause? Okay, where does this fluid come from? It is basics. Okay, we have already seen that blood volume is going to increase. So when blood volume is going to increase, there is more amount of extracellular fluid, and this fluid is going to cause a compression on the median nerve. Clear? Yes. Now this can be managed by wrist splint, or it can be even managed symptomatically. Okay, mostly managed symptomatically. If needed, we can give wrist splint also. And next one is there is an increased frequency of micturition. Okay, so it is mainly due to HCG hormone again. Okay, or even the progesterone and relaxin. Okay, now all these hormones are going to cause vasodilation. Okay, so what is going to happen is basically the renal blood flow is going to increase by 50%. Okay, now you would have understood why there is a increased frequency of micturition. And also another cause, you know, we have the uterus, okay, like this. Then anteriorly you have the bladder, and posteriorly you will have the rectum. Okay, so I wanted to tell in constipation also. So whenever there is enlargement of this uterus, it is going to compress both the bladder and the rectum. Yes, right? So what is going to happen is this can also be a cause of constipation as well as of the increased frequency of micturition. Can you understand? So the gravid uterus can also be a cause. Okay, and so as we have seen, the gravid uterus enlarges during the term. So frequency of micturition also increases nearing the pregnancy or near the term. Okay, so and remember to rule out any urinary tract infections also if there is a increased frequency of micturition. Okay, rule out increased urinary tract infections also. And sometimes there can be stress urinary incontinence also. Okay, apart from increased frequency of micturition, there can be stress urinary incontinence. Okay, sorry, stress urinary incontinence also. Can you understand? Yes. Now, how you manage this? Okay, how you will be managing this? See, management, you can go by ruling out asymptomatic bacteriuria. Okay, you have to rule out asymptomatic bacteriuria first, because we already have seen that asymptomatic bacteriuria is going to cause preterm labor and low birth weight. Okay, so this is not good for the patient. So first you have to rule out asymptomatic bacteriuria, and just because she is having increased frequency of menstruation, don't tell her restrict your fluid intake. Okay, fluid intake should not be restricted. Okay, never restrict fluid intake. Why? Because if you restrict fluid intake, it is only going to increase your chances of urinary tract infection, right? Okay. And also you can advise her to limit her caffeine drinks. Okay, so stay away from caffeinated drinks, or at least reduce the number of caffeinated drinks she will have usually. Okay, and suppose if she is having stress urinary incontinence, okay, in that case Kegel's exercise can also be advised. Kegel's exercise is basically a pelvic floor exercise. Okay, so this can be advised. Can you understand? Yeah. And the next one is about varicose veins. Yes, varicose veins do appear in pregnancy. And tell me, what are the sites varicose veins can occur? It can occur in the legs, vulva, or even rectum. Okay, so basically if it appears in rectum, the varicosity is called as hemorrhoids. Okay, so it can even appear in the vulva. Normally we know varicose veins we see in legs. Okay, so again if we see what are the causes, usually it is due to the pregnant uterus. Okay, the gravid uterus, what it is going to do, it is going to obstruct the venous return, right? And there is an increased volume of blood in pregnancy, and hormonal effect, progesterone, right? So what is going to do? It is going to dilate the walls of the veins. Okay, so basically a relaxation of the walls are caused. Okay, so that it is going to dilate the veins like that. Okay, so there is more varicosity, and if you see this, the varicosity is going to happen mostly during later gestation. Okay, later gestation only you can see this varicosity. Okay, now so there is an increased risk in multiple pregnancy because the compression is even more, right? So there is an increased risk in multiple pregnancies. So how will you manage this? Okay, so management, you have to advise her not to stand for longer periods. Okay, limb elevation can be advised. Okay, you can even give them compression stockings. Okay, then you can advise a left lateral position, because why? Because when the patient is lying in left lateral position, the uterus is not going to compress the venous return. Okay, so venous return will be enhanced, and so this can be relieved. Okay, and also you have to discourage them from giving a forcible massage if they have varicosities, and also avoid the injections and surgical management. Okay, mostly these will be not needed during course of pregnancy, because as soon as the delivery is going to happen, all these symptoms are going to revert. Okay, so basically no need of any injection or surgical management. We can do symptomatic management with the compression stockings and all. Suppose if you have vulval varicosities, they can be maintained by vulval compression stockings. Yes? Okay. Now, we will go to the next one, that is Bell's palsy. See, Bell's palsy also occurs due to fluid retention, as we have already seen, and there is a pressure on the nerve, that will be leading to perineural edema. Okay. Basically, this can also occur due to the immunosuppression in pregnancy, or there is also a state of hypercoagulability in pregnancy, which we have already discussed. So, this hypercoagulability can also lead to Bell's palsy. Okay. So, how you manage Bell's palsy? Generally, we are going to manage it with corticosteroids, right? So, here also the management will be, you have to give corticosteroids, right? Okay. Now, we will go to the next thing, that is syncope. Okay. So, basically syncope or dizziness is due to fall in BP. Okay. Again, why? It is due to, yes, it is due to progesterone hormone. So, what is progesterone hormone going to do? Again, it is going to dilate the blood vessels. So, there is a decrease in BP. Okay. Progesterone dilates the blood vessels. Okay. So, you can advise them to stay hydrated and, yes, left lateral position. Okay. Now, we will see about supine hypertension syndrome. Now, basically what is going to happen is, when the patient is going to lie supine, okay, supine posture, it is going to compress the vessels, okay, namely the inferior vena cava and the aorta, okay. So, this is going to reduce the venous return, and what will happen? The cardiac output will also reduce, yes. When BP is, when cardiac output is reducing, BP is also going to reduce. Okay, so this is what is going to happen, and the patient will go for a state of hypertension. Okay, so for this only, what we are advising is, you have to advise the patient to lie on her left side. Okay, if you ask the patient to lie on her left side, so this compression will be relieved. Okay, so there won't be any compression and there won't be any symptoms of hypertension also. Okay. Next one, we'll see about bleeding gums, okay, or pyogenic granuloma. Okay. Sometimes bleeding gums or pyogenic granuloma can occur in pregnancy. And what is pyogenic granuloma means? It is a reddish purple exophytic growth. Okay. So, you can manage it conservatively and asking them to maintain a proper oral hygiene. Yes. And sometimes some patients may even complain of backache, and there is lordosis of pregnancy, and this can happen due to hormone changes. Okay. And there is a anterior tilt of pelvis, okay, that can happen due to weight gain also, and especially the hormone estrogen and relaxin, okay, these are going to cause what? Laxity of the joints. So, all these reasons can add up to the backache and pregnancy. It can be managed by avoiding excessive weight gain, then you have to give them rest, okay, elevation of the legs, so that when legs are elevated, flexion of the hips will be brought about, which will help in protection of symptoms, and even we can ask them to get a massage. Okay. And we'll also see about edema in pregnancy, not the least one. Okay, so this is also due to increased body fluid accumulation. Okay, because as we already know, that is due to increased blood flow and volume. Okay, then with increased weight gain, okay, what happens is there can be increased fluid accumulation, but sometimes this can also happen due to preeclampsia. Okay, so you have to be careful about edema in pregnancy. Okay, so when edema happens, it will be usually happening in the limbs. Okay, but sometimes a generalized edema or anasarca can also occur. Okay, but when this occurs, it is mostly pathological. Okay, so how you can manage? Management is by decreasing the pressure on the veins. How? Yes, it is left lateral position. Then you have to ask them to keep their foot elevated. Then in this case you have to avoid tight elastic stockings. Okay, so if you take edema of the foot, okay, so this can be either unilateral or bilateral. Okay, and again this bilateral can be physiological or pathological. Okay, when it is physiological, it usually gets relieved within 12 hours. Okay, overnight if she sleeps and wake up in the morning, she won't find any edema. Slowly as the days goes, due to the compression of the uterus only, the stagnance is going to happen, and then only she will be having edema. Okay, but in pathological states, the edema is not going to reduce and it may increase in rates also. Okay, so what are the pathological causes means? It is preeclampsia, then it can be any problems in the heart like congestive cardiac failure, or any renal problems, or any hepatic problems, okay, hepatic disorders, conditions. Then it can also happen due to anemia and sometimes hypoproteinuria also. Understood? Yes. Now when there is unilateral edema, it is most commonly due to any trauma, cellulitis, and remember, don't forget about DVT and thrombophilia also. Understood? Okay, so these are some of the important minor elements. Okay, it will be helpful for you, I hope. So let's meet in the next video. Until then, happy learning, take care and bye bye.